It's a fallacy to assume that simply because a person is a member of an adult community, that they're online for the sole purpose of arranging a sexual encounter. Online communities are much more complex than it appears on the surface. Social sites are often used as a way to affirm one's identity. A gay man in an oppressive area or situation may find great solace and joy in finding other gay men, even if they only can meet virtually. I feel that the internet is a wonderful opportunity, a wonderful place to begin some practical work where integration of STD and HIV programs can take place, where there's new conversations around exciting new technologies and skill sets. And
clearly, the internet has been a vehicle where gay men have been comfortable meeting, and obviously contributes to opportunities for risky behavior.
What the internet does is it brings together people who might not otherwise meet. It can bring together people who take a little bit of risk into contact with people who take a great deal of risk.
One of my mentors, Mary McFarland, had done a study that was published in JAMA that showed that people who went online to find sex partners were at higher risk for STDs, for unprotected anal sex, for all sorts of risk behaviors.
We found back in 2003 we had so many people who were coming up with syphilis and HIV, and when the DIS, a disease intervention specialist, when the DIS spoke with the clients, they were telling the DIS that many of them, actually about 30% of them, were hooking up and meeting sex partners on the internet.
We found out that men who have sex with men are 10 times more likely to use the internet to find sex partners than their hetero counterparts.
And now they're texting, they're chatting, they're on the internet, and we need to be sensitive to that population. We can no longer live in the Stone Age.
As the health department as a whole, we felt we were missing a huge population. We just did not feel very well about not being able to serve that community. We said, what needs to be done? We need to do something innovative. We need to be able to reach out. We need to be at their level.
Many of our colleagues don't actually understand how gay men and other Americans use the internet to access healthcare information. When we have over 74% of our adults online looking for healthcare information, we need to step back and think, what does that mean for our HIV/AIDS programs?
So this work is very important on many levels, and the internet seems to be the place where we can get a handle on some new techniques.
Because as the internet has evolved and as people have used the internet more and more to meet sex partners, we as a public health community need to use the internet in order to engage and work with those people who are using the internet to meet sex partners.
It's an opportunity for DIS that have been doing great work for a long period of time to take on some new challenges and approach disease intervention in new ways. You thought it was bad when people would drive across town. Well, now, they're flying across the country because they've met on the internet.
So one of our jobs is to figure out, how do we make the network safer for everybody? How do we make it so that people are exchanging as much information as they're comfortable with about themselves and their partners?
Those we want to reach and serve are already using tools like social network sites, like MySpace, Facebook, are clearly on sites to ensure that they are able to connect with other gay men.
And wherever they are, we need to meet them where they are. I think that's very important.
Despite our health education mantra, we need to go where the people are, our practice is usually, let's drag people to where we are and hope that they come. And the truth is, most people don't come where we are. So the alternatives, let's go where they are, let's improve links, and let's work with internet sites and encourage them to help provide environmental supports that men will benefit from, even if they don't think of them as interventions, or even if we don't think of them as interventions, but they're things that will help, we believe, lower risk.
The internet provides new opportunities. The focus of issues such as stigma and discrimination are important issues for gay men's health. It's my personal belief that those are some of the foundations of some of the disproportionate infection rates and other issues that gay men face. It's important to remember that it's not all about sex, that it's about community, it's about connection. Personally, I believe that we're all seeking one thing at the core of ourselves, and that's to love and be loved.